Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will cover some important practice questions from the remaining eye and adnexia topic along with guidelines and quick elimination method so you can choose the correct option within a minute. So without further ado, let's get started. The ophthalmologist perform a technique to repair blepharoptosis by suspending the eyelid from the frontalis muscle above the eyelid. Prior to the surgery, the physician confirmed the surgical site and marked the planned incision with a pen. After anesthetic was delivered, the physician placed a traction suture through the upper eyelid margin and clamped it inferiorly. He then made the necessary incision in the eyelids and the brows. The physician used the blanket fascia as a sling using a fascia needle to thread the fascia between the incision. He squared the fascia or suture material after achieving optimal eyelid height and contour and closed the incision in layers. How should we code this procedure? Option A with code 67901. Option B with code 67903. Option C with code 67906. Option D with code 67908. In this scenario, blepharoptosis repair is performed by suspending the eyelid from the frontalis muscle located above the eyelid. This indicates the frontalis suspension technique is used. As during the procedure, pancreas fascia is used as a sling to support the drooping eyelid. Our correct option is option B with core 67902 used for the blepharoptosis frontalis muscle technique with autologous fascial sling. We eliminate option A with code 67901 used frontalis muscle technique but with the aid of a suture or donor tissue instead of autologous facial sling. Option C is incorrect with code 67906 which uses superior rectus technique to perform repair. Option D is also incorrect because code 67908 involves resection and plication of the levator and mullard muscle along with the tarsus and conjunctiva, which is a different surgical approach for treating blepharoptosis. An infant born at 33 weeks underwent 4 photocoagulation treatment to both eyes due to retinopathy of prematurity at 6 months of age. The physician used an operating microscope during this procedure. This treatment occurred once per day for a defined treatment period of 4 days. How would you report all of these services? Option A with code 67,229 along with 4550. Option B with code 67,229 into 4. Option C with code 67,229, 69,990. Option D with code 67,229. In this scenario, 4 photocoagulation treatments were performed on both eyes due to retinopathy of prematurity at 6 months of age. First, we eliminate option B according to the code description of CPT code 67229, which state one or more session. The code should be reported once per eye regardless of the number of treatment session. Therefore, reporting 4 units as shown in option B is incorrect. Next, we eliminate option C with add-on code 69990 for the use of an operating microscope. Always remember for ophthalmic procedure, the use of the operating microscope is bundled in the primary procedure and should not be reported separately. Option D is also incorrect with code 67229 as the procedure is performed bilaterally. We have to use the modify 50 as stated in the parenthetical note under the code. So our correct option is option A with code 67229 along with modifier 50. Dr. Thompson performed excision and repair of one half of the left eyelid margin of the Liman, a 60-year-old patient. During this procedure, Dr. Thompson also prepared for skin grafts. Liman will undergo the graft procedure once the eyelid margin is evaluated for proper healing. How should Dr. Thompson report his services? Option A with code 67,950 along with modifier LT. Option B with code 67,971 along with modifier LT. 15,120 along with modifier 59. Option C with code 67,966 along with modifier LT. 15,120 along with modifier 59. Option D with code 67,966 along with modifier LT. In this scenario, excision and repair of one half of the left eyelid margin were performed along with the preparation and application of a graft. Based on the type of the procedure performed, we first eliminate option A with code 67,950 used for reconstruction of the canthus. We also eliminate option B with code 67,971 which is used for the reconstruction of full thickness eyelid using torso-conjunctival flap from opposite eyelid. In both remaining options C and D, code 67,966 is used for the excision and repair of eyelid. As the code already includes the preparation and application of the graft, as mentioned in the code description, we don't need to code it separately with code 15,120 as mentioned in the option C. So our correct option is option D with code 67,966. Preoperative and postoperative diagnosis, total retina detachment, right eye. Procedure, complex repair of the retinal detachment with photocoagulation, sclerobuccal, sclerotomy, vitrectomy. Procedure, the patient was placed, prepped and wrapped in usual manner. Adequate local anesthesia was administered. The operating microscope was used to visualize the retina, which has fallen into the posterior cavity. The vitreous was extracted using the whisk to complete the posterior sclerotomy. Minimal scar tissue was removed to release tension from the choroid. The retina was repositioned and attached using photocoagulation laser, a gas bubble, and a suture placement of the sacral buccal around the eye. The positioning of the retina was checked during the procedure to ensure proper alignment. Antibiotic ointment was applied to the eye prior to the placement of the pressure page. The patient tolerated the procedure well and returned to the recovery suite in the satisfactory condition. But CPT codes should be reported with the following case. Option A with code 67,113 along with modifier RT, 67,107 along with modifier 51, 67,145 along with modifier 51, 66,990 along with modifier 51. Option B with code 67,113 along with modifier RT. Option C with code 67,113 along with modifier RT, 66,990 along with modifier RT. Option D with code 67,113 along with modifier RT, 69,990. In this scenario, a patient with total retinal detachment in the right eye undergoes a complex repair of the retinal detachment. For complex repair of retinal detachment, we use the CPT code 67,113. First, we eliminate option A with code 67,107, which is used for the repair of retinal detachment, circular buckling. As the circular buckling is already included in the code 67,113, as stated in the code description, therefore it should not be reported separately. Option C is incorrect with the add-on code 66,990 used for an ophthalmic endoscope which is not utilized during the procedure. We eliminate option D with add-on code 69,990 used for an operating microscope. Always remember for eye procedure, it is bundled into the primary procedure code and should not be reported separately. So our correct option is option B with code 61,113 along with modifier RT used for the complex retinal detachment repair in the right eye. The patient has chronic glaucoma morsware in the right eye. She is anesthetized with preocular anesthesia in the outpatient suite. The right eye is prepared wrapped followed by injection of lid speculum. A 3.4 mm clear corneal incision is made temporarily with a diamond plate. Viscoelastic material is injected into the anterior chamber over the pupil and lens to increase and maintain the anterior chamber depth followed by injection under the iris for 180 degrees to visualize the ciliary body processes with an endoscope. The endoscope is inserted through the incision viewing the nasal ciliary process, and the ciliary processes are coagulated through the endoscope with the endpoint of shrinkage and whitening. Assign the appropriate CPT code that best describes the encounter. Option A with code 62710 along with modified RT. Option B with code 62711 along with modified RT. Option C with code 60720 along with modified RT. Option D with code 66700 along with modified RT. In this scenario, a patient with chronic glaucoma in the right eye undergoes a destruction procedure on the ciliary body. As in this scenario, the destruction was performed through coagulation and the procedure is performed using an endoscope. The correct option is option B with code 66711 used for ciliary body destruction, site photocoagulation, endoscopic without concomitant removal of crystalline lens. We eliminate the other options based on the different method used for performing the same procedure. In option A, course 66710 is used when the ciliary body is destroyed using a laser beam. In the option C, course 66720 is used for destruction of the ciliary body by cryotherapy or applying extreme cold. In option D, course 66700 is used when the ciliary body is destroyed by applying heat. A patient returned to the emergency department with complaints of a painful eye. She reported that her left eye is constantly tearing and is sensitive to light. Upon examination, the physician identifies a corneal foreign body in the left eye. Using slit lamp, the foreign body is removed. Quote the encounter. Option A with code 65205 along with modified LT. Option B with code 65220 along with modified LT. Option C with code 65222 along with modified LT. Option D with code 65435 along with modified LT. In this scenario, a corneal foreign body in the left eye is removed using slit lamp. Based on the location and type of the procedure performed, a correct option is option C with code 65222 used for the removal of foreign body external eye cornea with slit lamp. We eliminate option A with code 65205 which is used for the removal of foreign body but from the conjunctiva. Option B is incorrect because the code 65220 is used for the removal of foreign body from the cornea but without the use of slit lamp. We eliminate option D because code 65435 is used for the removal of corneal epithelium which is not applicable in this case. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.